can be discharged.
However, the government insists that COVID-19 treatment in public facilities is free of charge.
This comes as Kenya reported 667 new cases in one day, driving the total to 16,268.
The Kenyatta University Teaching and Referral Hospital has emerged as one of the best go-to public facilities for COVID-19. But now a section of those admitted there claim it is now raiding their pockets.
Tukikuja hapa tu kujua kulipisha. Walianza kulipisha jana.
One woman who called KTN News claims she and her 3 children have been at this facility for the last 1 month. One of her children who has tested negative is being asked to part with 90,000 shillings before release. She is now fearing that she'll pay close to 400,000 Kenya shillings for herself and family when they are being discharged.
Amount 3,135 kitanda peke yake per day. Na uongeze madawa. Madawa hujaeka.
But the government is firm that no public hospital should charge for COVID-19 patients admitted there.
And this is a case that we've actually managed and we are managing to follow through. There are no costs, and the Cabinet Secretary has announced this several times. There are no costs at public facilities when it comes to treatment.
If government says it is not asking for payment, one wonders who then is charging these patients. And today the number of new COVID-19 cases increased by 667.
And this brings to total the number of positive cases in the country to 16,268. And our cumulative cases stand at 266,102.
The Health CAS also announced that 11 more people had died over the last 24 hours. But even as she gave the daily statistics, Dr. Mwangangi observed that the overall HIV infection numbers had also gone down during this period.
And what this means is that majority of our people are no longer visiting health facilities for HIV testing services, and therefore there's a decline in knowing the true status when it comes to HIV.
Meanwhile, Kenya has reported 311 recoveries, taking the total number of those allowed to go home to 7,446. Mark Namaswa, KTN News.
On a similar note, the government directive to have people wear face masks while in public has slowly become the norm for many of us.
But what is now commonly referred to as